Hi everyone. Today I am going to take you through the anatomy of the knee, focusing especially in the posterior view or the posterior part, but also giving you a broader understanding how this amazing joint or this amazing part works in our body. Today I am going to explain you the knee for my English class, and let's start with the general introduction. In this part, in the knee introduction, we have that is the most complex and important joint in our body because it connects the thigh to the lower leg and allows us to perform the essential movements like we can see in the image, like running, walking, jumping, and also sitting. We use this for every action that we do every day. So, although it may look simple in the outside, we can see that the knee is like a normal part of our body, but the knee is a powerhouse made of bones, ligaments, tendons, muscles, nerves, blood vessels, and also synovial structures that are so important that all working together make like a perfect coordination and also can make our different movements in our body. So the first part are the knee bones, the structure. There are three main bones in the knee that are the most important. The first one is the femur. The femur is the image or the video that I am going to show you in the medial part of the screen. So this one. The femur is the thigh bone, is lower and has two rounded structure called the medial and lateral condyles that we can see in the last part of the base of the video. The tibia is situated or is in the left part. The tibia is the shin bone. It supports most of the body weight and also forms the lower part of the knee joint that we can see in red color because this is like the weight of our body in this joint or in this bone. And the last one is the patella and kneecap that I consider is the most important joint and the most important bone in the part of our leg. So a small sesame bone is involved of quadriceps tendon and it protects the knee that we can see in the image and improves the leverage of the quadriceps muscle. The quadriceps muscle is the part in red color that is connected with the patella that we can see in this image and in this video. Now we can see the posterior muscles that are the stability of our knee. The first one is the popliteus. The popliteus muscle is the most important muscle, but is the shorter and smaller muscle in the legs and also in the knee. We can see this muscle and we say that this muscle was so small, so smaller than others. But what is the function of this? That is a like a accessory in our knee? No, we see that the popliteus muscle lies deep is in the back of the knee and is the small but the most important because unlocks the knee when we start to bend it and helps to rotate the tibia inward. We can see in this video like the flexion and the extension of the knee is controlled by this muscle in this part, the flexion and extension. In the next part we have the plantaris. The plantaris muscle is thin and the thin muscle that with a tendon and this allow and has a minor role in the movement. This is often used like a tendon graft because it is used in the different surgeries in our body because this like we can see that and also this allows to replace different structures of our knee with this plantaris muscle. The next one is the gastrocnemius muscle. That is the larger muscle in the body. This is visible muscle with two heads that has the medial that we can see in this part of the video, the medial and the lateral one. It contributes to the knee flexion and also is more active at the ankle. In the ankle part that is in the like in the base of the leg. Yes. This also helps in the plantar flexion, like when you stand of your toes. Is like when you do different movements and your feet locate like this part, like this part on your toes. Then we have the hamstrings that are the semitendinosus, semimembranosus, and the biceps femoris. Other muscles like the hamstrings originate from the back of the thigh and also cross the knee joint, helping the knee flexion and also the hip extension, like we can see in these videos. Extension and flexion. Flexion, así, like this, and extension like this. Then we have an important part because our is the irrigation of our knee are the blood vessels, and the first ones are the arteries. Behind the knee is an important region called the popliteal fossa that is in a shallow diamond shape, like this. In the region or the in the posterior part of the knee that is the popliteal fossa. Uh, these have a lot of structures like blood vessels, nerves, and also muscles that are inserts in this part. And the femoral artery, for example, is the first one that we can see in this part. This is the femoral artery that coming from the thigh becomes the popliteal artery, and it passes through the adductor hiatus. The first one is this is the popliteal. Yes. So wait. This is the popliteal. And the popliteal artery gives us several branches that we have, like the superior genicular arteries that are sides of the knee that work in this part of the knee, in the medium part. The muscular branches to surrounding the muscles, like the gastrocnemius that we can see in this image, this is the knee, and the muscular branches work or extend in this part, in the anterior part. And then we have the inferior genicular arteries that continue down the leg. So the knee, and it works in the posterior part, and works like to continue to the feet, and also to the different structures in the lower part of our body. Then we have the veins. The popliteal veins, it runs alongside the artery and carries the blood back to toward to the heart that we can see in this video. Like run in this side to the heart. And this vascular network is essential for supplying oxygen and nutrients to the lower limb. Now we have the major nerves. The sciatic nerve travels down the back of the thigh and divides near to the top of the knee into the tibial nerve that we can see in this movement, in this moment in the video. The tibial nerve, the sciatic divides in the tibial nerve that it travels down through the calf of the innervates the muscles like the gastrocnemius, soleus, plantaris, and popliteus. Then we have the common fibular nerve that is also called the perineal that we can see in this part. So wait. Uh, that it wraps around the fibular neck and splits into two branches that control the muscles in the front and the posterior part of the leg that we can see. So this is the sciatic nerve, the first one. The next one is the tibial nerve that divides in also the fibular nerve. There are three fibular nerves, and also that controls the front and the front and posterior part. Injury to the nerves can affect all the movements that we do every day, like sit, jump, run, and also walk. So we can do different exercises in this part for try to reduce the different injuries or the different pains in the leg, and also in the most important part of in the knee. Finally, we have the ligaments that are the anterior cruciate ligament, that is the ACL, and the posterior cruciate ligament PCL, that control the front to back movement of the tibia and femur, that we can see in a pink color. Then the pink color and the pink color and green color. And the medial collateral ligament, the MCL, is the blue one. The blue one is the MCL and the LCL, that is the lateral collateral ligament and medial collateral ligament, that prevent side to side displacement and provide lateral stability, that we can see in the video. Stability and also the displacement side to side, that is the rotation and also the flexion and extension. Finally, we have the menisci and synovial structures between the femur and the tibia are the menisci, two crescent-shaped fibrocartilage pads. The medial meniscus is in the right side of this video, in the first one video. So wait, in this video is in the right side. The medial meniscus is more fixed and prone to injury, and the lateral is in the in the left side, that is more mobile. So we use two the different movements. The lateral meniscus and the medial meniscus is the meniscus that control of the rotations and also the that uh, supports all the injuries in this part of the knee. The roles include the shock absorption that we can see in the image, the joint stability, and also the distribution of the synovial fluid. The knee also contains bursae that are the is in the second video are the little circles or the little like bursts are the small sacs in green color that contains a lot of synovial fluid and also proteins and other fluids that contribute to reduce the friction in this part, because this allows that the bones broke and also make that we feel a lot of pain. The most notable is the supraplantar bursa that is in the posterior and anterior part, and that is located in the kneecap. The function and biomechanics is that the knee allows the flexion, bending the leg, that is the first one image, the extension, straightening the leg, and rotation, the sleek internal and external rotation when the knee is flexed. The flexibility combined with strength makes the knee both versatile and vulnerable to injury. So especially it supports and students, eh, especially in like in sports that we have to support a lot of weight or sudden movements. We can like lose the control of our movements and broke our knee and produce a lot of pain. Finally, as you can see, the knee is much more than just a hang. It's dynamic, intricate, and an intricate structure that balances of our mobility and stability. Understanding the anatomy of the knee, we helps that not only to field of medicine and physical therapy, but also in injury prevention, like and performance enhancement. Thank you so much for watching and listening my presentation, and take care of your knees because they are so important, and take care of you. Bye bye.